If your sciatica disappears for a few weeks or a month and then suddenly come back, do not immediately assume that you damage your spine again. The pain may feel exactly the same, but the reason behind it may be completely different. And after 50, there are 4 major reasons why sciatica keeps returning, including one that many people mistake for another disc herniation. And the first reason is simple but often misunderstood. The nerve may still be sensitive even after the original episode has improved. A nerve root that has been irritated for weeks or months does not always return to normal immediately. Please remember this, my dear viewers. The inflammation may decrease, maybe the pain will disappear, and you may start walking better, and you may even sleep better. And then after a long car ride, prolonged sitting, lifting, or another period of irritation, the familiar pain returns. This is something I regularly see when I work with my patients. And here is the most important part. A painful flare does not automatically mean new structural damage. Pain intensify and tissues damage are not always proportional to what you are experiencing. And that is one of the most important things people with a recurring sciatica needs to understand. Because if you interpret every flare as I damage my disc again, you may spend years being afraid of normal movement and never understand what is actually happening to your spine. But this is only the first possibility. You need to remember something else. The second reason becomes increasingly important, especially after 50 years and older. The space around the nerve may be getting smaller. This is something I regularly see. As the lumbar spine ages, discs can lose their height, facet joints can enlarge because of arthritis or similar kind of conditions. The huge possibility is your ligaments may thicken, and the opening where the nerve exits the spine can gradually narrow. This is called foraminal stenosis and one of the most serious conditions of your spine. Imagine a nerve passing through a tunnel. If that tunnel becomes narrower, the nerve may tolerate normal activity on some days, but on some other days, certain position or loads may reduce the available space even more and you are getting sicker. Now we came to the third possibility, and this one is especially common after 50 and 60. What you think is recurring sciatica may actually be a lumbar spinal stenosis. And there is a pattern, and I really want you to recognize this. You been walking, for the first few minutes you may feel almost normal. Then your buttocks or legs begin to hurt, just a little bit. Then may feel a little bit heavy. And you may develop tingling or your numbness. This is especially important symptom. And sometimes both legs are involved. That means that something's actually critical happened in your spine. Then after a few steps, maybe more, you stop, you sit down or bend slightly forward, and the symptoms are improved. You're feeling a lot better. Then you start walking again, and all of the symptoms returning again. And that pattern gives us an important clue. This is something I regularly see when I work with my patients. And there is one question that often separates your spinal stenosis from typical disc flare. And that question, of course, is going to be what happens when you sit down. You must think about this. With lumbar spinal stenosis, sitting or bending forward often reduce symptoms because it can temporarily increase the available space around your nerves. That's why you're feeling a lot better. Not diagnose spinal stenosis by itself, please, my dear viewers. But it's a very important clinical pattern. And if you have been told for the years that every episode is just sciatica, this distinction can completely change how we think about your problem. Now let us come to the fourth possibility. the disc itself may once again be involved. This is one of the most important things. A new disc herniation, it really can happen, and previously damaged disc can become irritated again. And after previous disc surgery, a recurrent herniation is also possible. This is unbelievably important information. You must remember this. But symptoms alone cannot tell us what with certainty. This is where MRI can be really useful. And this is also where MRI can create enormous confusion. A scan can show disc degeneration, a bulging disc, arthritis, foraminal narrowing, spinal stenosis, or even herniation in some people who has relatively mild symptoms. And another person may have severe leg pain while the MRI does not look nearly dramatic. So I want you to remember this. We do not treat MRI words. We treat the real person. The scan must match the clinical picture. Where does your pain travel? Is the pain below the knee? Which part of the foot is numb? Has your strength changed? Can you walk normally? Are the symptoms improving, stable, or progressively worsening? Those details really matter. And this is exactly where I see one of the biggest mistakes in spinal care. People become obsessed with sentence in MRI report. Maybe you will see disc protrusion. You will see disc extrusion, nerve root compression. You will see degenerative changes, but the MRI report does not tell you the whole story. In more than 26 years of working with patients, I have repeatedly seen people with frightening MRI reports who function surprisingly well, and others whose symptoms are severe even though the imaging findings appear much less dramatic. So now we come to the part of the sciatica that matters even more than the pain. It's going to be neurological function. And if your pain is severe, that matters. But if your leg progressively getting weaker, that matters even more. And if your foot begin catching the floor, if you cannot lift the front of your foot normally, if you cannot longer stand on your toes as you could before, or your leg is repeatedly giving you away, you need proper medical assessment. This is where the situation changes from how much that is really hurt to is it the nerve beginning to lose its function. This is critical situation. And there are several symptoms that should never be treated as ordinary recurring sciatica. New loss of bladder or bowel control, numbness around the saddle of genital area, or severe and rapidly progressive weakness. Those symptoms require urgent medical evaluation. And do not wait for you in the next routine appointment. Now, if your sciatica keeps coming back and nobody has clearly explained why, this is exactly how I approach those patients in our work at Mario Lab Center in Zagreb, Croatia. I do not look only at the MRI. I look at the pain pattern, neurological symptoms, strength, walking ability, function, and what actually changing over time. We combine more than 26 years of clinical experience with individuals' Mario Lab treatment programs, physical therapy, and rehabilitation. And patients can come to our center in Zagreb, but we also work with people internationally. Patients can come to our center in Zagreb, but we also work with patients internationally who cannot travel to Croatia. You can contact Mario Lab Center through WhatsApp or the Viber at number +385 9891 79200. Full contact details in the video description. But now let me give you the most important takeaway from this entire video. If your sciatica keeps returning, do not ask only how do I make the pain disappear. Ask why is this nerve becoming irritated again? Is the nerve still sensitive from the previous episode? Is the opening around the nerve getting narrower? Is spinal stenosis developing? Or is there a new disc problem? Those are different mechanisms, and they may require different decisions. Now, there is one more question that almost every patient with disc-related sciatica eventually asks. Can a herniated disc actually shrink without surgery? The answer is yes in many cases, and the mechanism is fascinating because your own immune system can participate in breaking down and removing part of the herniating fragment. In the next video on the Mario Lab Physio and the Rehab channel, I will explain exactly how this happens, which type of herniated disc are almost likely to shrink naturally, and when waiting is no longer the right decision. Watch the video next.